Let's start off with what's completely normal after surgery: swelling and pain. Your knee has just gone through a major surgery, and some swelling is your body's natural healing response. But too much swelling can slow you down. It limits motion, increases discomfort, and makes it harder to progress your rehab. So what can you do to manage it? Try to keep your leg elevated above the level of your heart whenever you're resting, whether lying down or sitting. Pillows or a foam wedge work great for this. Elevation uses gravity to encourage fluid to drain away from the knee, reducing swelling and the pressure that causes pain and stiffness. Aim to elevate for about 20 to 30 minutes at a time, multiple times a day. Combine this with ankle pumps, flexing and pointing your foot, which is a simple but powerful way to boost circulation. By moving your ankle frequently, you activate the muscles in your lower leg that act like pumps, pushing blood and lymph fluid back to your heart. This reduces fluid pooling around the knee and helps prevent blood clots. Try doing ankle pumps for 1 to 2 minutes every hour while awake, especially during long periods of sitting or rest. I suggest considering compression socks, which provide gentle, consistent pressure to your lower leg. This pressure helps prevent fluid from accumulating in the tissues around your knee and ankle, reducing the feeling of heaviness and tightness. Wear them throughout the day and then take them off at night before you sleep. Make sure they fit well. Too tight can restrict circulation and cause discomfort, and too loose won't be effective. Make sure the compression stockings are not causing any numbness or tingling or increased pain. In this case, you might want to try a different size. Ice therapy is one of the best ways to control swelling and managing pain after activity. Apply a cold pack or an ice wrap in a thin towel to your knee about 15 to 20 minutes, especially after exercises or when swelling flares up. Cold causes blood vessels to constrict, limiting fluid leakage into the tissues and reducing inflammation. Personally, I love the use of a cryo wrap. It provides a deeper cooling and pain relief. You'll find a link to one that I recommend in the description below. Now, these strategies have proven to help manage pain and swelling, but doing them occasionally won't cut it. Consistency is key. Make swelling management part of your daily routine, and it will help reduce pain and support mobility and help you move more comfortably and confidently.